Republicans at the State House are moving forward with a bill that would implement work requirements for some people to stay on Medicaid. State House reporter Skylar Talal has more.
A GOP-led bill directs Iowa HHS to request federal approval to require able-bodied Iowans to work 80 hours each month to keep their Medicaid insurance through Iowa's Health and Wellness Plan. Exceptions include people under 19 or over 65 years old, individuals who are disabled or medically exempt. Republicans say it'll get more Iowans off government programs and back to work.
Some of our estimations that we've looked at when it comes to able-bodied Iowans on the Medicaid expansion plan is up to potentially 100,000 Iowans that would meet the criteria to be able to be working but currently are not working.
Roughly 180,000 Iowans are enrolled in the program. The Nonpartisan Legislative Services Agency estimates roughly 32,000 would lose health insurance due to the requirements.
Neither senators who asked nor LSA could get any information, any figures from HHS. That is really not acceptable. I don't know how we're supposed to build a program or build a budget in Iowa when we can't get the figures we need from our own executive branch.
The bill adds trigger language saying if they get approval from the federal government, it can't be revoked later on without getting rid of Iowa's health and wellness plan altogether.
A change of administration, we don't feel that we should invest as a state to get a program that best fits Iowa, and then with the new administration coming in, I think it's something that puts Iowa in the driver's seat for this program to make sure that it's going to best work for our state.
Democrats claim Republicans are gambling with Iowans' lives, saying this bill sends the wrong message that people in poverty are lazy.
This last week on the debate floor was opportunity to take away health care from 181,000 Iowans, which also risks closing rural health care centers and, frankly, some health care centers in cities. That's what I heard in Sioux City when I was there last weekend.
The Senate still needs to approve the current version of this bill before heading to Governor Kim Reynolds' desk. In Des Moines, Skylar Talal reporting.
Governor Reynolds is already directing HHS to submit a work requirement waiver, which her office says will be done soon. A spokesperson says, quote, the waiver will match the current bill moving through legislation and will install new eligibility requirements for Iowans to be covered by Medicaid. They also say there will be a grace period for people to comply with the work requirements or lose coverage. House Republicans say they know the governor is doing this and want to codify it so a future governor can't undo it. Still ahead.